Hi folks, Ron Ray here. I just wanted to pop in real quick and give a little tip. I heard a couple of questions recently about how do you go to a hospital and start getting into the hospital and getting referrals from a hospital. And I think the first question that you should ask yourself is, are you even ready for that? I think that it would be a big mistake to go into a hospital and start developing a relationship there to finally get a referral, and then you have to tell that hospital referral source that, oh, I'm sorry, I don't have any caregivers available. Well, guess what? You did all that work and now they're never going to refer to you again. So make sure that you are ready for that in the first place. Make sure that you've got the caretakers and the ability to take on those patients, because I think once that you start getting that first referral from a hospital, you kind of break the ice. You kind of break the dam. Well, they're going to start rolling in as long as you can prove to that person at the hospital, that discharge coordinator or social worker, whoever it is at the hospital, that you can handle it, you can handle their volume, they're going to send you lots of work. But if they show up the first time and you can't help them after you've been telling them you want to help them, well, they're never going to give you a shot again. But let's say that you are ready. Let's say that you have the resources available and you're ready to start going into hospitals and asking referrals. The first thing you really need to do is you can't just walk in and say, hey, I do home health and I'd appreciate the business. That's not going to cut it. I think you really have to make yourself stand out from the crowd, because they're getting, you're not the only one in town. They're getting solicited by home health and hospice and durable medical equipment companies and assisted living facilities, skilled nursing facilities, all these different providers of services all the time. So, and they all kind of have the same pitch. Hey, we're here. We want you to send us some referrals so we can get some business. But a referral relationship really needs to be a two-way street. But in your case, you don't want to send people back to the hospital. They don't want you to send people back to the hospital. So how can this be a two-way street? They're going to give you referrals, but I can't really give them referrals because they don't want people coming back to their hospital. And the reason for that is Medicare and the Affordable Care Act penalize hospitals for readmissions. Okay? The insurance companies and Medicare do not want to keep paying hospitals for services, and so they encourage hospitals to take good care of their patients to a point where they don't come back. And if they do come back and they come back too often, they start penalizing them. They start reducing the rate of money that they pay to the hospitals. So the first thing you can do is, number one, find out kind of what your hospital specializes in. Most hospitals have a specialty, whether it's heart attacks or strokes or cancer or children. Most hospitals have a specialty. They do all the general medicine as well, but they have something that they specialize in. So find out what that is, and then figure out how you can specialize in that thing as well. So strokes, is a big customer base for home health, because people with strokes need help taking care of themselves. So if you have a stroke hospital in your area, figure out how you can specialize in taking care of stroke patients. And then you can go to the hospital and to the care coordinators, the discharge coordinators, and say, hey, you specialize in stroke patients. I specialize in stroke patients. So I'm very familiar with how to take care of your patients. The second thing is, do a little bit of research on the hospital's readmission rate. So that's all public information. Those programs are paid for with public tax dollars, and therefore that makes all of that data public information, and it's published very readily. So there is a website. I use it all the time in the insurance business, but it's handy for the home healthcare business as well, called the Kaiser Family Foundation. They have a website called the Kaiser Health News, and there's a page here where you can look up your hospital and see if they're being penalized. So if we just want to look up here in my area in Texas, scroll down here to Texas, and we will hit, let's say, San Antonio. See if I can spell it right. San Antonio, Texas. And we're going to click on this tab right here that says readmission. So the percentage of the penalty varies by their readmission rate. So these numbers right here represent, that's the percentage that is being deducted from their payments from Medicare. So this hospital, Baptist Medical Center, in 2015 was being penalized 0.52%. And then in 2016, it went up to 0.61, and then it started going down, and they're pretty low now. And in the past 2 years, they have no penalties at all. Okay, now let's find one that's a little bit on the high side. How about this Texas Spine and Surgical Hospital? Holy cow, they're being penalized 2.25% all up and through 2020, and now in 2021, they must have gotten their readmission rates down because their penalties down to 0.59. Okay, so there is a good example of how you can look that up. And if I wanted to get hospital specific, there's a hospital near me called Resolute. Okay, well, their penalties going up. Started out 2017 at 0.38, 2018 0.93, 2019 1.5% penalty, 2020 1.68% penalty, 2021 it's down slightly, but it's still pretty high. So I might go into that hospital and say, hey, I really specialize in fall prevention and making sure a person's house is set up so that they are able to get home, get rehabilitated safely and quickly and not be readmitted. I specialize in lowering your readmission rates. So I will post a link to this video right in the comments section down below, so you can go to this site and look up your hospital, and then you just go to the hospital's website simply and find out what they specialize in. And I hope that's a good tip. If you have any other tips or any comments or anything, just comment down below, and be sure and like and subscribe, and click the little notification bell so that you can get updates every time that I post a video. Remember, I'm in this journey with you, and I'm starting my home health company and bringing you inside behind the curtains as I start and build my home health care company. And I just want to be totally transparent and show you everything that I'm doing, and pass along all the tips, all the mistakes, everything that happens, good and bad, so that hopefully that helps you be just a little bit more successful than me. So until next time, we'll see you. Thanks.